Hi all, today Obg Unit 1. Already we had a discussion of define the terms. In that 3-4 things I left it that we will be discussing today, and remaining 1 unit we will be discussing today. Okay, let's start. In the define the terms we have discussed, in that few things I left over that I am adding today. One is Eutocia. Eutocia. Eutocia means it's a normal childbirth, okay, where the uterine is getting contracted and cervix is getting dilated and fetal is coming down. Normal delivery. Okay? Eutocia. Eutocia means it's a normal childbirth characterized by uterus is getting, or uterine contraction is happening. With the uterine contraction, progressively cervix is getting dilated and baby is coming out. That is known as eutocia. Next one is gravida. Gravida means total number of gravida is a medical term which we say that gravida describes total number of confirmed pregnancy, means live birth. How many children? Some people say, no, I have 2 babies and 1 got expired. Okay, that is not considered as gravida. 2 live baby is considered as gravida. Okay, gravida is a medical term describing total number of confirmed pregnancy woman had. That is known as gravida. Next one is para. Para or parity. Okay, Parity, parity. Parity means number of birth, whether it is life or death. The woman had a carrying, right? So that total number will be calculated as para. Don't get confused. Number of live birth is known as gravida. Total number of carrying happened, whether it is life or death. Okay, that is known as para. Okay, hysterectomy. Hysterectomy, you already know, it's a removal of uterus. Then parturition. Parturition is like a woman carrying a womb or fetus in the womb, okay, and after 40 weeks of gestation it is coming out through the vagina or through C-section, is known as pasteurization. Okay, it's the end of pregnancy. 1 or more babies leave the uterus by passing through vagina or C-section. Okay, this is known as pasteurization. So in that few was remaining, so we have just covered it there today. Next we are going to history collection. History collection already you know, first year, second year and all, you went for posting, you know how to collect history and all, right? Patient identity, what is the chief complaint of the patient, any past medical history, present medical history, past surgical history, right? Or any medication is ongoing following for the patient, such as diabetic, thyroid, any certain allergies and all. That will be the history collection for first. Except that, what will be collecting for OBG is like, we will be collecting menstrual history. What is the last menstrual period? Like if the person, every month we have menstrual cycle, right? Last month, which date was the first day of menses? Okay, that is counted as last menstrual period. Then, what was the age of menarche? If you know menarche, you will get what if you don't understand, then it is easy for you. What was the first age of menarche? And if it is 40 plus a gynae patient, we can say what is the age of menopause. Like maybe due to some of the hysterectomy patient, menopause will be there, or some of the secondary diseases, menopause will be there. So the age we have to know. What is the length of the cycle? See, in a menstrual cycle, we know it might be 5 to 7 days normal, bleeding will be there. So for each one is different. So we have to ask them what is their cycle and how many days do they bleed. Every month, how many days is like 28 days. Actually, they have to, after each 28 days, they have to bleed. Okay, as per normal cycle. But some people can take 29 days. 30 days, some take little less day as per the climate changes and all. So we have to ask them how is their cycle. Okay, then I told the flow of blood. Few people, maybe they are anemic, only 1 day they will bleed and then the rest of the days they don't bleed. Okay, so we have to ask them how is the flow, how many pads do they change. Okay, and for menstrual cycle, every month they will be having PMS, premenstrual syndrome. Okay, That will be like they will be getting irritated easily, very much mood swing, lower abdominal cramping pain, back pain, headache, vomiting. Some people will be very much severe, like they will be vomiting and they will lie down. They don't have the capacity to stand also. Okay, that is the PMS syndrome. That will be coming under menstrual history. Okay, then we are going to deal about sexual history. At which age the person's sexually active? Menarche they are asking. Then whether you have only one sex partner. Okay, did you have a history of sexual abuse, okay, or sexual assault? That has to be mentioned there, because you already know what sexual disorder patients and all, so we have to inquire about it. Then contraceptive history, like any contraception, like anything prevents pregnancy. IUD, intrauterine devices, they can insert, like copper T and all, or like external condoms and all. So if anything is there, we have to inquire whether, why, for what purpose they have put it. Okay, how, when they have removed it, while removing they had any side effects and all, for what reason they have removed it. If it, while putting IUD they had any bleeding or something. Okay, especially for copper T and all, bleeding will be there. So all that history we have to take. Then gynae history. Gynae history, that person is having any sexually transmitted disease or pelvic inflammatory disease such as chlamydia, gonorrhea, okay, vaginitis, is there any vulvalitis, lesions, including any due to some of the fungal infection, the person will be having itching, redness and all the things we have to inquire. That is about gynae history. So this was all about history collection. Fine. Then we are going to deal with physical examination. Physical examination, as you know, we have to check the height, we have to check the weight, we have to count the BMI, right? Then BP, abdominal examination, inspection, auscultation, palpation, percussion. Then breast self-examination, especially for female, we have to do breast self-examination. It's nothing, I think so, you in first year you might have seen in the front of the mirror, the person self-examination. Breast self-examination, they have to look whether the breast size of the both right and left is same, or there is any lump or something is present in the circular motion. By putting their hand up, if they are putting their right hand up with the left hand up, with the help of the right hand, they have to do in a circular motion whether there is any lump present. Okay, and the same in the right, same vice versa in the next side they have to do, as well as they have to do it in the lying position. One hand should be up, and they have to palpate and see whether there is any lump present, whether size are different, is the nipple cracked, okay, or is there any discharge or pus or something coming from the breast, sizes are same or not. That is known as breast self-examination. Okay, that picture I will be giving to you in the notes. Fine. Then pelvic examination will be done. Pelvic examination is like externally they will be seeing, okay, the person will be in a lithotomy position. If you know lithotomy position, you will understand. External examination they will be doing, okay, they will be seeing the perineal area. How is it? Is there any pus or infection present in the perineal area? Then they will be doing a test known as pap smear. Okay, pap smear is nothing. If there is any infection, something inside our genital area, we have to know it, right? For that, we will be doing a examination that is known as pap smear. Pap smear will be done with the help of an instrument known as cuscus. Cuscus. The instrument's name is cuscus. It is like, its front will be like this, and it will be having two handles. With that, we can operate it. What we do is like, patient will be in a lithotomy position, and we'll ask the patient to relax. Okay, what we'll do is like, this machine I said, this instrument is like this, right? So it has a handle like this. So once we insert in the vagina, we have to open it. We have to just press it like this, it will get open. Fine. And we can get visualize of the bladder, cervix, uterus, everything. And we have to just scrape it little, take it for test. That is known as pap smear. Okay, that also, that image of cuscus and all I will be updating in the notes. Please refer that. Fine. This was about pap smear. Then we are going to deal about, this was all about physical examination. Investigation. Investigation, we know we will be doing blood test. Blood test in that CBC we will be doing. Okay. Then urine test. Okay. Then especially in blood test we will be doing LH, FSH, TSH, PRL. Okay. Utilizing hormone test and all we will be doing here, because to know whether the person is having any menarche, menopause, amenorrhea, menstrual irregularities, infertility also. Then imaging test, USG ultrasound scanning will be done. Then hysterosalpingography. Hysterosalpingography. Salpingitis means fallopian tube. Okay. Hysterectomy or hysterect is hystero is known as uterus. So graphy means visualization of the uterus as well as the fallopian tube. You know, no, the uterus has fallopian tube like this. So the visualization of the uterus and the fallopian tube is known as hysterosalpingography. Then sonography will be done. Then last we can do biopsy for the patient. So here ends your first unit. Okay, you can see the first unit, it was define the terms, history collection, physical examination and investigation. Fine, notes will be updated soon. I hope you understand. If anything is there, please let me know.